Syphilis is an infection caused by a bacteria. Most often, it spreads through sexual contact. The disease starts as a sore that's often painless and typically appears on the genitals, rectum, or mouth. Syphilis spreads from person to person through direct contact with these sores. It also can be passed to a baby during pregnancy and childbirth, and sometimes through breastfeeding. After the infection happens, syphilis bacteria can stay in the body for many years without causing symptoms. But the infection can become active again. Without treatment, syphilis can damage the heart, brain, or other organs. It can become life-threatening. Early syphilis can be cured, sometimes with a single shot of medicine called penicillin. That's why it's key to get a healthcare checkup as soon as you notice any symptoms of syphilis. All pregnant people should get tested for syphilis at their first prenatal checkup too. Syphilis develops in stages. The symptoms vary with each stage, but the stages may overlap. And the symptoms don't always happen in the same order. You may be infected with syphilis bacteria without noticing any symptoms for years. Primary syphilis. The first symptom of syphilis is a small sore called chancre. The sore is often painless. It appears at the spot where the bacteria entered your body. Most people with syphilis develop only one chancre. Some people get more than one. The chancre often forms about 3 weeks after you come in contact with syphilis bacteria. Many people who have syphilis don't notice the chancre. That's because it's usually painless. It also may be hidden within the vagina or rectum. The chancre heals on its own within 3 to 6 weeks. Secondary syphilis. You may get a rash while the first chancre heals, or a few weeks after it heals. A rash caused by syphilis often is not itchy, may look rough, red or reddish-brown, and might be so faint that it's so hard to see. The rash often starts on the trunk of the body. That includes the chest, stomach area, pelvis, and the back. In time, it also could appear on the limbs, the palms of the hand, and the soles of the feet. Along with the rash, you may have symptoms such as wart-like sores on the mouth or genital area, hair loss, muscle aches, fever, sore throat, fatigue, weight loss, and swollen lymph nodes. Symptoms of secondary syphilis may go away on their own, but without treatment, they could come and go for months or years. Latent syphilis. If you aren't treated for syphilis, the disease moves from the secondary stage to the latent stage. This also is called the hidden stage because you have no symptoms. The latent stage can last for years. Your symptoms may never come back, but without treatment, the disease might lead to a major health problem called complications. Tertiary syphilis. After the latent stage, up to 30 to 40% of the people with syphilis who don't get treatment have complications known as the tertiary syphilis. Another name for it is the late syphilis. The disease may damage the brain, nerves, eyes, heart, blood vessels, liver, and bones and joints. These problems may happen many years after the original untreated infection. Congenital syphilis. Pregnant people who have syphilis can pass the disease to their babies. Unborn babies can become infected through the organ that provides nutrients and oxygen in the womb, called the placenta. Infection also can happen during birth. Newborns with congenital syphilis might have no symptoms, but without fast treatment, some babies might get sores and rashes on the skin, fever, jaundice, anemia, swollen spleen and liver, sneezing or stuffed nose, and bone changes. Later, symptoms may include deafness, teeth problems, and saddle nose, a condition in which the bridge of the nose collapses. Babies with syphilis also can be born too early. They may die in the womb before birth, or they could die after birth. When to see a doctor? Call a member of your healthcare team if you or your child has any symptoms of syphilis. These could include any unusual discharge or a sore or a rash, especially in the groin area. Also, get tested for syphilis if you have had sexual contact with someone who might have the disease. If you have another sexual transmitted disease such as HIV. If you are pregnant. If you have regular sex with more than one partner. And if you have unprotected sex. Now, the causes. The cause of syphilis is a bacterium called Treponema pallidum. The most common way syphilis spread is through contact with an infected person's sore during vaginal, oral, or anal sex. Less often, syphilis can spread by kissing or touching an active sore on the lips, tongue, mouth, breath, or genitals. It can also be passed to babies during pregnancy and childbirth, and sometimes through breastfeeding. Syphilis can't be spread through casual contact with objects that an infected person has touched. Now, to the most important part of this video, the prevention. There is no vaccine for syphilis. To help prevent the spread of syphilis, follow these 5 tips. 1. Have safe sex or no sex. The only certain way to avoid contact with syphilis bacteria is to not have sex. This is called abstinence. If a person is sexually active, safer sex means a long-term relationship in which you and your partner have sex only with each other and neither of you is infected. Before you have sex with someone new, you should both get tested for syphilis and other sexually transmitted infections. 2. Use a latex condom. Condoms can lower your risk of getting or spreading syphilis, but condoms work only if you cover an infected person's syphilis source. Other types of birth control do not lower your risk of syphilis. 3. Be careful with alcohol and stay away from street drugs. Drinking too much alcohol or taking drugs can get in the way of your judgment. Either can lead to unsafe sex. 4. Do not douche. It can remove some of the healthy bacteria that's usually in the vagina, and that might raise your risk of getting STIs. 5. Breastfeed with caution. Syphilis can pass from a parent to a baby during breastfeeding if sores are on one or both breasts. This can happen when the baby or pumping equipment touches a sore. To keep that from happening, pump or hand express breast milk from the breast with sores. Do so until the sores heal. If your pump touches a sore, get rid of the milk you just pumped. Thank you for being with me to the end of this video. Kindly subscribe to my YouTube channel if you haven't. If you have any questions or comments, leave it down there in the comment section. If you find this video informative, kindly share it to your family and friends. I have other amazing videos as this. Till we meet again, take a very good care of yourself. Remember, you can also make a difference. And don't forget, Kofi loves you. Peace out.